my gloves on. Can I see your name again, please? Okay, can you tell me your name, please?
Gladys Hoover.
And can you tell me your date of birth, please?
9/29/1969.
And can you tell me your medical record number, please?
1121415.
And do you have any tape or latex allergies?
No.
And do you have any allergies that are to food or environmental or medication allergies?
No.
Okay, so everything that she just told me matches her name band and matches the chart. The next thing that I'm going to do is I'm going to take her vital signs. So after taking her vital signs, her blood pressure is 120/78, her heart rate is 72, her respirations per minute are 18, her oxygen saturation is 99%, and her temperature is 98.7 degrees Fahrenheit, and all of those vitals are within the normal range. Are you experiencing any pain?
Sore throat.
When did your sore throat start?
A couple of weeks ago.
And where does your sore throat hurt?
Right here.
And how long has your sore throat been going on? Has it been constant or?
It's on and off for a couple of weeks now.
Okay, and how does your sore throat feel?
It feels like a lump in my throat. It's very hard to swallow.
Okay, is there anything that makes your sore throat worse?
When I eat and I swallow.
Is there anything that makes your sore throat feel better?
Hot coffee, hot tea.
Have you tried any treatments for your sore throat?
Lozenges.
And on a scale of 0 to 10, how severe is your pain?
About 4.
Okay. So the next thing I'm going to do is assess my patient's level of consciousness. So just looking at her right now, she doesn't appear to be in any distress, and her body is symmetric. Can you tell me your name, please?
Gladys Hoover.
And can you tell me where you are right now, please?
St. Joseph Hospital.
And can you tell me the date, please?
October 2nd, 2020.
Okay, so my patient is oriented to person, place, and time. So the next thing that I'm going to do is I'm going to assess her equipment. So first I'm going to check and see on the provider's orders what she has, and she's supposed to have 2 liters of oxygen by nasal cannula. So I'm going to check and make sure that's what's on the provider's orders, and that's what she has, and they match, which they do. I'm going to check around the nasal cannula for any skin breakdown, and that the placement is correct, and that there are no kinks or loops in the tubing. The next thing that I'm going to do is assess the IV. So according to the provider's order, she's supposed to have 0.9% sodium chloride at 100 milliliters per hour. And I'm going to assess and make sure that that is what the provider orders has, and that's what she has, and they match, which they do. Okay, I'm going to take a look at her IV. Do you feel any tenderness around your
No
IV?
tenderness.
And I don't see any evidence of redness or swelling, and I don't see any kinks or loops in the tubing. Next, I'm going to assess her catheter. She doesn't have a catheter in right now, but if she did, I would assess it accordingly by checking that the placement was correct. There was no skin breakdown around the area. Also, check to make sure that there's no skin breakdown around the area for the IV. And that it was securely, the catheter was securely taped to her leg, and that the bag was on the bed frame. And I would document the color, clarity, and amount of urine that she has. Next, I'm going to assess her hair. So the first thing that I'm going to do is look and see her hair distribution. And her hair distribution is even. The texture of her hair is soft. The color of her hair is black. And I don't see any evidence of lesions, skin breakdown, lice, or dandruff. And the next thing that I'm going to do is, do you experience any itching in your scalp?
No itching.
Okay, and the next thing I'm going to do is assess her skin. So after assessing her skin, I see that there's no skin breakdown, wounds, lesions, drainage, or dressings, and her skin temperature is warm, the color of her skin is pink, and her skin is dry. Next thing I'm going to do is assess her skin turgor. So can I see? Okay, so I'm going to pinch, and it returns back to place. Next, I'm going to test to see if she has any pitting edema. So I'm going to do that by pressing my thumb down on her tibia and seeing if it leaves an indent, which it does not, so no evidence of pitting edema. Next, I'm going to assess her capillary refill. Okay. Okay, so capillary refill is less than 3 seconds in all areas. Okay, so the next thing that I'm going to do is I'm going to assess her ears. So just looking at her ears right now, she does not, they are both symmetric, and she does not appear to have any skin lesions or skin breakdown. And then checking inside her external ear with the scope, I don't see any foreign objects, skin breakdown, lesions, or swelling. Next, I'm going to assess her eyes. So I'm going to assess the pupil reactivity. Okay, and then can you follow my pen for me, please?
Mhm.
Okay, and so her pupils are equal, round, and reactive to light and accommodation. Next, I'm going to check in her eyes, see the color of her sclera and conjunctiva. So her sclera is white and her conjunctiva is clear. Next, I'm going to be checking her nares. So looking at her nares, I don't see any skin breakdown or lesions, and her septum is in the midline. Next, I'm going to look at her mouth, tongue, and oropharynx. So can you open your mouth for me, please? And can you stick your tongue out and say ah? Okay, so in looking at her mouth, tongue, and oropharynx, I don't see any skin breakdown, swelling, the color is normal, and her uvula is in the midline. Next, I'm going to assess her facial muscles. So can you smile for me, please? And her facial symmetry is even. Next, I'm going to do her respiratory system. So can you sit over to the side for me? Okay, so in a real assessment, I would make sure to auscultate directly on the skin, but for the purpose of this video, I will be going over the clothes. So when you feel my stethoscope touch your back, can you take a deep breath in and out for me, please?
Yes.
Okay, and also just sitting here and looking at her now, I don't see any evidence of her using accessory muscles to assist her breathing. Listening to her lungs, I did not hear any decreased or adventitious breath sounds. Okay, she does not have an incentive spirometer, but if she did, I would teach her how to use it and then have her demonstrate how to use it back to me. Okay, so the next thing I'm going to be doing is cardiac. So come over here and just, can you put your head kind of toward that head of the bike for me, please? So the first thing that I'm going to do is palpate the carotid arteries individually. Okay, and I did not feel any thrills from that. Next, I'm going to assess her radial pulses. Can you turn your okay, no thrills there either. And then her dorsalis pedis. Okay, I did not feel any thrills there either. Okay, so next I'm going to do her, I'm going to palpate her carotid and her PMI. I'm going to use the bell to palpate, to auscultate these. Okay, and I did not hear any heaves or lifts when I was doing that. The next thing that I'm going to be doing is auscultating her heart valve. So I'm going to start at the right sternal border in the second intercostal space for the aortic valve, and then move over to the left sternal border, second intercostal space for her pulmonic valve, and then go below that in the third intercostal space for the Erb's point, also on the left sternal border. And then I'm going to go below that in the fourth intercostal space on the left sternal border for the tricuspid, and then I'm going to go in the fifth intercostal space in the midclavicular line for the mitral valve. And I'm going to auscultate all these points using both my bell and my diaphragm. So starting with the diaphragm. Okay, so her rhythm and rate were normal, and I didn't hear any extra breath sounds. And also for the for just the same as the respiratory, I am auscultating over the close here, but in a real assessment I wouldn't do that. I also forgot, I'm going to go over this again with my bell, because last time I went over with the diaphragm. Okay, so just like with my diaphragm, her rhythm and rate were normal, and I did not hear any extra breath sounds. The next thing I'm going to be doing is her GI system. So if you could lay down for me, please. And recently, have you been vomiting or been nauseous or had diarrhea?
No.
Okay, and when was your last bowel movement?
This morning.
And was that normal or abnormal for you?
Normal.
Okay. So the first thing I'm going to do is look at her stomach. And her stomach is symmetrical. I don't see any pulsations, and the shape is also normal. So first thing that I'm going to do is auscultate all four quadrants. Okay, and so I heard normal bowel sounds in all four quadrants, but if I did not hear any bowel sounds, I would listen in all four quadrants for 5 minutes. Okay, next I'm going to do palpation. Oh, actually first I'm going to auscultate the aorta. Okay, and in her aorta, I did not hear any heaves or lifts or bruits. Okay, now I'm going to start by doing light palpation in all four quadrants. Do you feel any tenderness as I do this?
No.
Okay, just let me know if you feel any tenderness. Okay, now I'm going to do deep palpation. Any tenderness?
No.
You don't feel anything? Okay. So she did not appear to be guarding, and I did not feel any masses when I was palpating. Okay, so that's all for that. Next, I'm going to assess her GU system. So you can sit up if you want. I'm just going to ask you some questions. So, how often do you urinate per day normally?
About 5 or 6 times.
Okay, and have you been urinating more than normal recently?
No.
Okay, and the next thing I'm gonna ask is when did you last urinate?
About a couple of hours ago.
Okay, and is that normal, or was that normal or abnormal for you?
That was normal for me.
Okay, and then I would assess the intake and output for the patient. And I would monitor the intake and output for a patient. Okay, so next I'm going to test her extremities. So are you experiencing any numbness, swelling, or tingles in your extremities?
No?
Okay. Can you grip my hands, please? Okay. And then I'm gonna push and pull against your feet, and I would just like you to try and resist me as I do that. Okay, so resist. Okay, and then resist. Okay. So her muscle strength is 5 out of 5 in all extremities. Okay, so the next thing that I'm going to do is do final checks. So I'm going to make sure that her call light is within her reach and she knows how to use it. I'm going to make sure that the bed is in the lower position and that her side rails are up. Is there anything else that you would like me to do?
No, I'm good. Thank you very much.
Okay, so then I would wash my hands and